for the intro, Jennifer. That is quite a mouthful for you. And as Jennifer said, I'm currently working on a PhD project to develop a framework for evidence synthesis focused on health inequality or inequity research. Right, I'm just going to move my slides. So can you all see that? Yeah, okay. So I'm going to kick off with some definitions for people who might not be familiar with some of the terms. So what is evidence synthesis? This is a process of systematically reviewing or combining existing research to generate a comprehensive and unbiased summary of available evidence on a specific topic. So there are different types of evidence synthesis, and I've just put some examples on the slide, which include your non-standardized literature reviews, scoping reviews that seek to identify research gaps and opportunities for evidence synthesis rather than searching for the effect of an intervention. And we've got rapid reviews, which apply systematic review methodology within a time-constrained setting, therefore may employ methodological shortcuts. Then we've got the systematic reviews, which is the most commonly referred to type of evidence synthesis. So when people are talking about evidence synthesis, the first thing that comes to mind is a systematic review. And then we have meta-analyses. These use statistical methods to objectively evaluate, synthesize and summarize results. And you've also got umbrella reviews, which are reviews of other systematic reviews. And then I move on to inequality versus inequity. So evidence synthesis plays a crucial role in driving decision-making processes aimed at reducing health inequality or health inequity. And while these terms are often used interchangeably, they have distinct meanings. So health inequality refers to the variation in health across different groups within a population. On the other hand, health inequity refers to the unjust and avoidable systematic differences in health outcomes between different groups stemming from social and structural factors. So health inequality and inequity are complex and pervasive issues that continue to challenge healthcare systems and public health researchers worldwide. And addressing these health inequalities and inequities requires interventions that are evidence-based and informed by an understanding of the underlying factors causing these differences. So in evidence synthesis, various frameworks have been developed to guide researchers in assessing health inequality or inequity. And I'm just going to talk you through a few of these examples. One prominent framework is the Progress Plus framework, which focuses on key determinants of health disparities, including place of residence, race or ethnicity, occupation, gender or sex, religion, education, socioeconomic status, and social capital. While the plus signifies additional factors like age, disability, and sexual orientation, but this is just a few. There could be other factors as well that we could list here. Another framework is the social determinants of health that people will be familiar with from Dahlgren and Whitehead, which emphasizes the broader societal factors that contribute to health disparities, such as income inequality, education, and access to health. And we also have the health equity impact assessment, which assesses the potential health impacts of policies and interventions on different population groups. So these are just a few. There's a lot of frameworks out there, but I'm just listing just a few examples. Now, health inequalities and inequities are often the result of complex interplay of multiple factors. Put simply, some people are healthier than others, And this difference is often caused by a mix of various factors. So there's a need to create a new way of gathering and analyzing information in health inequality or inequity research. The current methods that examples that I've just talked about often focus on one aspect, like socioeconomic status as an example, and don't consider the full picture, like considering the other factors as well. So imagine trying to understand a complex puzzle by looking at just one piece. What I'm proposing is a new framework which aims to be more comprehensive, taking into account the various factors that contribute to health disparities. So it's like stepping back and looking at the entire puzzle to see how all the pieces fit together, giving us a better understanding of why some people might face health inequalities or inequities. So for my project, I aim to bridge this gap by consulting experts in the fields of health inequality or inequity and evidence synthesis to identify additions to my proposed framework. So additions to the current frameworks that exist. Experts were identified through consultation with key stakeholders in the field and sourcing records of published research. I contacted them via email, introducing the framework development project, and invited them to participate in a consensus workshop. I sent about 13 emails to experts, and the emails outlined the project's objectives, the expected time commitment, and the potential benefits of involvement. And interested experts were asked to confirm their participation, and a suitable date for a consensus workshop was selected based on their availability. It was quite difficult to get to try and get everyone in the room at the same time. So eventually 3 workshops were held between March and July of 2023. So I had different experts in these 3 workshops, and the discussions were led by myself and facilitated by my colleague, Pauline Addis. And each meeting was held online for approximately an hour and a half. The workshops were designed to be interactive and collaborative, allowing for the exchange of ideas and the generation of consensus among the experts. The workshop sessions were audio and video recorded to capture the conversations and discussions among the experts. And written notes and summaries were taken during the sessions to record key points, agreements, and disagreements. So the recorded workshop sessions and written notes were then transcribed and organized for analyses. So I used a thematic analysis approach to identify key themes, patterns, and areas of consensus or disagreement among the experts. And the identified themes and patterns were then used to inform the development of the key concepts for consideration in this new framework that I'm proposing. So 8 out of the 13 experts that I invited participated in the workshops. Their varied backgrounds and expertise are detailed in the table that you can see here. And to safeguard the anonymity of the participants, I have substituted their names with unique participant ID, such as P1 for participant number 1. But as you can see from the table there were various expertise involved in these discussions. And from their affiliation, you can see that they're from different organizations as well. So 3 concepts emerged from the workshop discussions. Currently, there are inconsistencies in the way inequality or inequity is reported in evidence synthesis. This was also part of my one of my papers that I did for my PhD, where I identified this inconsistency. So for the proposed framework, we're highlighting, well, I'm highlighting the importance of distinguishing between health inequality and inequity, underlying that not all health differences are inequities. So one of the things that I'm proposing is that when you're conducting evidence synthesis research on inequality or inequity, first things first, define the focus of the review. Is it inequality or is it about inequity? Secondly, from the discussion, there was emphasis on the significance of intersectionality, incorporating intersectionality, recognizing that individuals' experiences of health disparities are shaped by multiple intersecting social identities and commercial determinants. And intersectionality was introduced to us by a lady called Kimberly Crenshaw, but she works in legal. She works in a completely different field, which is about legal. But then she was also talking about intersectionality, and we thought maybe that's one thing that we could incorporate in evidence synthesis as well. And furthermore, the framework would incorporate the life course perspective, acknowledging that health disparities evolve over an individual's lifespan and are influenced by cumulative advantages or disadvantages. Okay, so let me put this into context, excuse me. Say you're conducting a systematic review examining diabetes prevalence among adults in any region, and you want to apply these concepts. Let's break down each concept and see how it can be applied in evidence synthesis and how it complements or works alongside other relevant frameworks. So as I said, the first thing you need to do is to define the focus of your review. So in this example, you state whether you're interested in inequality, for example. If you focus on the health inequality column, the middle column, are you interested in the differences in prevalence rates between groups? For example, high prevalence of diabetes among individuals aged 50 and above compared to those under 30. This is in the causes tab. This age-related disparity in diabetes prevalence would be a form of inequality, which might be due to, say, natural aging processes or lifestyle choices, which, while leading to differences in health outcomes, are not inherently unfair or unjust. Or are you interested in inequity? This is your right-hand column. And by inequity, I mean identifying discriminatory healthcare practices or systemic barriers. So let's say in region X, there are significant disparities in diabetes prevalence between two neighborhoods, and I'll call them neighborhood A and neighborhood B. In neighborhood A, the prevalence of diabetes is significantly higher compared to neighborhood B, even though the populations of the two neighborhoods have similar demographic characteristics. So it might be that the residents in neighborhood A have lower income, limited access to healthy food, and less access to healthcare resources, for example, which would increase their risk of diabetes. While in neighborhood B, residents have better access to healthcare services and healthier food options. In this case, the higher prevalence of diabetes in neighborhood A compared to neighborhood B would be an example of inequity. It is unjust and avoidable as it is rooted in structural factors such as socioeconomic disparities in terms of lower income and unequal access to healthcare. So secondly, using the if we were to apply intersectionality, we would use an intersectionality matrix where we would analyze how multiple social factors intersect to create the unique health disparities in individuals. So, for example, you might analyze how diabetes rates differ among Black women of low socioeconomic status compared to white women of high socioeconomic status. So there I've just given like 3 types of factors to include when you're looking at inequalities there. And finally, using the life course approach, this would enable us to assess how early life factors, so in the case of diabetes, example would be childhood nutrition or midlife circumstances such as job-related stress, and later life factors such as access to healthcare in old age contribute to diabetes prevalence in the region. So the proposed framework offers a valuable perspective on health disparities, but faces challenges in implementing and measuring inequality and inequity due to some limitations, particularly in identifying intersecting social identities. There may be a scarcity of studies that directly apply the intersectionality or life course theory, and we may also encounter variations in how different studies define and implement concepts such as intersectionality or life course. And this doesn't need anyone from any explanation, but this can be time consuming and resource intensive. And I would recommend improved reporting of intersecting identities at primary study level, as well as collaboration with stakeholders in the form of patient and public involvement and engagement. So the current state of evidence synthesis in health inequality or inequity research is inadequate in capturing the multifaceted and dynamic nature of the issue. To move beyond single estimates and isolated determinants, I'm proposing a holistic framework, and this framework encourages us assessing differences between health inequality and health inequity, applying intersectionality theory, and employing the life course approach, offering valuable additions to the toolkit of evidence synthesis, public health practitioners and policymakers. In conclusion, I would like to emphasize that this research is currently work in progress. Your valuable feedback is essential to its development, and I welcome any insights or suggestions from you as the audience. Moving forward, my research priorities include exploring its application in various case studies. So I'm going to try and apply what I'm proposing in various evidence synthesis research this year, and continuously refine the associated methods to effectively address health disparities. Thank you for your attention, and I look forward to any questions or comments you may have. I've provided my email address, and just a reminder that this presentation is funded through the National Institute for Health and Care Research Policy Research Unit in Older People and Frailty, as Jennifer had already stated earlier. Thank you very much.
Thanks, Patience. It's exciting work, and right in line with the goals of the equity group within Cochrane. So I'm going to invite everybody now to ask questions if you have or have any comments for Patience. You can unmute and discuss here, or you can add your comments to the chat. I also put in Patience's email address to the chat in case you want to send her a note directly. Yeah. Anybody want to get started with a discussion? Yeah, Catherine.
Hi, Jennifer. Nice to see you, Patience,
Yes.
and Jennifer. We've just been
Yeah,
emailing today by
that's
coincidence.
right. Nice to see
Um,
you.
yeah, and thank you, Patience, for you know, there's always so much that's really thought-provoking in this area. So I'm Katrin. I'm a professor of evidence-based healthcare at University of Nottingham in the UK, and I'm also part of the JBI network, currently sort of leading their qualitative methods group. And we've been really thinking about this whole issue a great deal, I suppose, personally from the perspective of qualitative evidence synthesis. We've been sort of thinking about this and writing a bit about this and looking, like you've said, at the various sort of frameworks available and thinking how they apply specifically to qualitative evidence synthesis. I'm interested to know if you're sort of thinking about qualitative evidence synthesis at all, or how you see the role of qualitative evidence synthesis perhaps in taking particularly the sort of intersectionality analyses forward. And I agree. I think there's a real issue in we have such a lack of data and lack of relevant analyses in our current primary research. So I think until the reporting there and the approach changes, there's going to be a need for a lot of sort of additional inference and stakeholder involvement, etc., to sort of try and explore these issues when we come to think about how we synthesize that. But sorry, that's an aside. But yeah, so what's your view on how qualitative evidence synthesis is impacted by this, or could address this area?
Yes, can you hear me? Yeah. So one of the things that I was proposing as well was employing a hybrid approach that combines evidence synthesis methodologies with qualitative community-based research, leveraging its existing health databases while being mindful of privacy concerns as well. So at the moment, I have no idea how that would work, but that is also something that I was also interested in looking at.
Thank you.
Yeah.
Yeah, I mean, I think currently there's a lot of scope for qualitative, even without doing additional primary research, but for qualitative evidence syntheses to complement equity-focused, other types of equity-focused reviews in the sense of mixed method reviews, perhaps particularly also realist reviews have a lot to offer in this space. But yeah, I think there's a lot of work to do still. So yeah, thank you.
Okay. Thank you very much for that. That's something for me to think about as well.
Another question then, sorry if I can just jump in, but
yeah, of course.
did your participants talk about reflexivity at all, and equity in the sense of the review team and the review methods and processes? So I hear what you're saying about sort of how we apply a lens and tools and procedures to the review data, but what about the actual the whole approach? So thinking about the evidence sort of ecosystem a bit more widely, and you know how we develop the questions in the first place, who's on the team, who's around the table, how we address power dynamics potentially within that team. Did your participants say anything about that?
No, we didn't discuss that, but that's quite interesting that you've brought that up. That's something that I can actually work on as well. I mean, as this is work in progress, I mean, I can go back to them. It's just that I couldn't name them today, but they are actually professors in evidence synthesis. But
Sure.
yeah, I can go back to them and give them suggestions, explain that this is what I found in my presentations. But thank you very much for that. Yeah.
Thank you.
Yeah.
Thanks, Katrin. Anybody else have comments or Patience? We, in our work with the equity group, are really struggling with the concepts of intersectionality and how we can help authors think about intersectionality within their reviews. So Patience, your work is going to be helpful for us. So give some pointers for people about what they what they can do, because like I think you've pointed out, that progress is what we usually recommend, but it really keeps things into separate buckets, and it would be nice to be able to give some advice for what to do or how to handle sort of the intersectionality of these characteristics across populations within the studies that we want to include. But yeah, I don't have an answer, so I'm hoping you come to us with some answers of what to do with that.
Yes.
Yeah.
Yeah, I know there's a group that's been formed recently. Yes. For us to try and figure out how to apply intersectionality in evidence synthesis. So I am part of that group, and I'll look forward to the discussions going forward. Yeah.
Yeah.
So just to say, we don't have the answers yet. Everything that we're doing is exploration. So
that's right.
Yeah.
Yeah. Okay. If there aren't any more comments or questions for Patience, we can end the webinar for today, but you all have her email address. So if you think of something, please get in touch with Patience and give her your feedback, and or maybe get on the list to see draft versions of it if Patience is open to getting some external input. But otherwise, thank you so much for joining us today. And thanks, Patience, for your great presentation.
Thank you very much. And thank you all
Okay.
for joining.
Thank you, everybody.